7:24 coming up to a 7:25 in Trinidad and Tobago. Let's return to this dialogue about labor relations in the context of this workplace policy, whether it's mandatory, whether it's semi-mandatory, however you want to refer to it, because we are joined now by Ramkumar Narayan Singh, who is the Managing Director and Principal Consultant of SYZYGY Limited, which offers consultation to the private sector in relation to labor relations and so on, because he comes from that labor environment. Indeed, you might recall our first interaction with him publicly would have been with the closure of ArcelorMittal so many years ago and representing the workers at that time, because we wanted to get some perspectives on government's new vaccination policy, as it appears to be with public service workers. The government took too long, apparently, to address the issue of vaccination in the workforce, and he maintains, this is Mr. Narayan Singh, that private sector companies were left to fend for themselves and most overcame the hurdle of ignorant and misplaced fear regarding vaccination that employees were harboring. The union fraternity's position of being against vaccination becoming a condition for continued employment, in his perspective, is untenable. And according to Mr. Narayan Singh, this situation is not one where the employer is seeking to change the terms of employment based on mere preference and choice. Well, having said all that he said, let's hear him say what he has to say now. Ramkumar Narayan Singh, very good morning to you. Thanks so much for joining us.
Good morning, Fazir, and good morning to Trinidad and Tobago.
Good to have you.
Fazir,
good to have you with us. Go ahead.
I want to kick it off by addressing a situation that we have going on with the EHE right now. I looked at his, I listened to his comments, and unfortunately, his comments were definitely provoking. And he made some comments there regarding what is going to happen or what could happen with the workers if they don't comply. And unfortunately, from an IR standpoint, his position is not tenable. In the first instance, if the government makes a change to its policy and it places a demand on the employees to comply or face not having work, that doesn't constitute job abandonment. So he's used that out of context, and it is unfortunate because he does have the Ministry of Labor and all these other IR support mechanisms in the government sector for guiding them on how to properly approach this situation. I'm certain that is going to come up in his conversation this afternoon with Labor Fraternity. And then again, what we have seen is a maximum effort coming from the government earlier in the year to develop a national policy on the process of managing COVID or the pandemic. And by extension, as per what you may recall, or the conversation I started last year on my part regarding the development of a communicable virus prevention policy, not just dealing with COVID, but everything else that may come thereafter that may be similarly impacting on the country. And as I understand, we had a lot of academics, a lot of specialists, a lot of civil society engagement in the development of the policy or the draft. And unfortunately, that draft is somewhere on a shelf gathering dust. And the government has moved ahead and implemented this new mandate. So in effect, what the government has done is provoke the entire country, definitely the labor fraternity, and they've not implemented the document that was consulted upon and created. I don't know what is the status of the document, if it was finalized or otherwise. And they've come to a point where now it's inflammatory, the whole decision of so-called mandate to vaccinate. And that is definitely going to create some unrest in this country. Now, whether the government has the legal authority or ability to do it or not, I am almost certain that they do have that for zero, because of what exists as it stands in law as it relates to vaccination. And I again will quickly remind the public that we do have a Vaccination Act of Trinidad and Tobago that sets somewhat of a precedent on how the situation could be approached from a legal standpoint.
Could I just interrupt you for 30 seconds? And I'm sure you're aware of what the president of the Industrial Court said at the start of the last term. And he said that this cannot be done unilaterally.
That is a correct statement. As a matter of fact, I looked at her entire presentation, and what I gathered at the end of it was that she made a salient point that this has to be a conversation that where you can have maximum interaction to ensure that there is minimum apprehension at the end of the day when the final decision, whatever that decision may be, is arrived upon. So she is, in effect, she has provided an insightful perspective. I do think, unfortunately, that that message went over the heads of some in the government. I also do think, though, that the union, the labor fraternity, doesn't have a good handle on their approach to the situation. You see, if you approach arrogance and ignorance with equal measure, you're going to have chaos. I think the labor fraternity's call not just should be for respecting what they're claiming to be the rights of all the citizens or all their members to choose not to vaccinate, but also they should be able to provide some alternative answers and suggestions. And what was, for me, what was quite concerning was when the labor fraternity or the leader of JTAM was asked, Mr. Roger was asked by the reporters, I think on Saturday or Sunday, News Express article, what was his comment on the potential arrival, the arrival of Omicron and the Delta variant that, that's currently ravaging the country. He said they had no comment at this time. And that is scary for me. I am sure that they are discussing alternatives, and I'm sure that they would have put forward in their contribution for the national policy suggestions on how we can manage the spread of COVID and how it should be created as a policy for the workplace. And I didn't hear them reiterate it if they in fact did it.
Ramkumar, all right, so we're going to pause in a couple of minutes, but before we take that break and resume our discussion, I think it's fair to say that we're aware that when it comes to public statements on both sides, there's a lot of political posturing here. The government don't want to be seen to be backing down to nobody. The union, likewise, they like to use a lot of gun talk when it comes to these sorts of situations. Is it fair to say that maybe at some point both sides can recognize that it's time to tone down this sort of language if we really want to be serious about good labor relations and moving things forward in Trinidad and Tobago?
I don't think they will. That's the problem. It is fair to say that they should. The problem is I don't think they will. The private sector seem to have figured it out. But apparently, because the private sector is the minimum party in this, in the truth, because the state is the biggest employer in the country, controlling 80% or so of the staff. And of course, the union is the union fraternity represents these said workers. So you have giants arguing, fighting, and creating chaos. And the private sector quietly has had to contend with it, figure it out. And apparently nobody seems to be interested in identifying how and why to really move forward progressively.
Well, we'll pause for a moment to continue that point, because it's interesting how you talk about the giants, because I think there's a familiar saying about when elephants fight, the grass gets trampled. That's exactly what appears to be happening based on your own explanation of the situation right now. We'll return to our dialogue with Ramkumar Narayan Singh, who is the Managing Director and Chief Consultant with SYZYGY Ltd. We'll take a quick break and return to that dialogue. It's time now for another traffic update courtesy of Traffic. No, it's a flower actually. It's the zinnia that we're presenting to you this morning as we go to that break and return to our dialogue with Mr. Narayan Singh. 7:37 in Trinidad and Tobago. Thank you so much for still being with us as we're coming into the last few minutes of our show on this Wednesday morning. But let's return to our dialogue with Ramkumar Narayan Singh, someone who was once very active in the labour movement but is now the Managing Director and Chief Consultant for SYZYGY Ltd and offering consultancy services to the private sector and other agencies as far as labour relations. Ramkumar, I mean, a lot of people are wondering what's going to happen come the middle of January if this thing kicks in as the government seems insistent that it will. Any concerns in your area specifically? I think your mic is muted, Ram Kumar. We're not hearing you for some reason. I don't know if something happened there.
Okay, I'm sorry.
Right. We've got you now. We've got you now. Go right ahead.
Okay, yeah. So the biggest concern, the potential fallout, if the government moves ahead and creates a law to impose vaccination especially on the people who are working in their environment. When you look at the statistics with the police, the fire, and all these other state institutions that provide these essential services, and you recognize that if the people take a position that they are not going to vaccinate, regardless of what what the unions or the government says, the potential for a high level of unrest exists. So I'm hoping that the AG and the union, when they go into this conversation this afternoon, they keep that at the back of their minds, both parties. A few things one or two things I want to add here in terms of some consideration. One, even in the private sector, where we have achieved a high percentage of vaccination compliance, not through forcing, but rather through a stringent process of educating our membership, as far as even bringing in doctors to talk to staff members and have free medicals set up so that people can be mentally at ease when they take their vaccination. And we're not seeing that effort, unfortunately, from the government. That personalized medical being done so that a person can be directly aware of their personal well-being status, so that they can be at ease when they take the vaccine, unfortunately. So what I'm saying is, one, the government really needs to have that policy position rolled out, not a law, but a policy position established through all these parties' mutual consent. And that's one. The second thing is the government really needs to consider now allowing the persons to administer self-tests. People need to be able to mentally, confirm so that for their own mental peace.
But again, just on that, Ramkumar, and I'll sound repetitive for our viewers, okay, because you would not have seen earlier segments of the show. But the health minister, when we spoke to him last week, explained why they can't roll up, because people will be hesitant to push the thing way back. To do it properly, they will just at the front of the nose and will therefore get false negatives, and that would be even more dangerous.
Okay, so yeah, and I can respect his professional opinion there, but when you look at some of those countries right now, and the research is there on the internet, is everywhere, where even there are tests now that even children can administer for themselves, that gives you a high percentage of accuracy in determining whether you're sick or not. So I don't know where, I understand he has his professionals and whatever, but these are at the very least considerate, so that mask wearing, of course, if you're not vaccinating people, you're going to have to enforce mandatory mask wearing in the workplace and apply a stringent process. You need to get OSHA involved. They're ignoring the OSHA Act, they're ignoring the potential that the OSHA Act has for managing the situation, which will move away from the AG having to go and create a whole bunch of legislation. They're ignoring all the other alternatives that exist out there for people to take care of themselves. And as it is right now for zero, a lot of people are simply not testing. They're getting sick. They're staying home. And they're not reporting it because they're afraid. They don't want to end up in quarantine for 21 days. That's a fact. That's a fact in terms of what's going on out there.
But that's a reality, Ramkumar Narayan Singh, and this is something that we've discussed. If people are living purely on the basis of their meager salary, whatever it might be, and cannot afford to stay home, if they suddenly start to feel sick tonight, me telling nobody?
And that is the reality that we're living in, and that is under that ambience, this conversation this afternoon. Whatever is coming out of this conversation is going to determine what's going to happen. And like I said, the concern right now, especially in the private sector, where we've only just had a recent resumption of business, and no companies have not recovered. Nobody's going to recover from this anytime soon.
But Ramkumar Narayan Singh, you talk about this conversation this afternoon. How do you really have a conversation after you've heard the Prime Minister say that this is going to happen no matter what all you say, one. And two, you have the AG the day before saying, well, you know, people go end up getting laid off from this.
Well, no one man is bigger than the entire system that exists as a country and as a government. And I'll tell you this, we haven't really seen it quite often, but under the conditions that we have, people have to be prepared to accept that they have taken a wrong position. People have to be prepared to accept that, listen, here's what we need to come to some kind of agreement so that we move forward. The private sector in Trinidad and Tobago cannot continue to carry the burden of managing the situation. There must be a clear position from the government and the union on how they expect to manage the situation, given the two polarized positions that exist. On one side, the government is demanding it. After a year of wasting time, they're now decided that they want to impose, ignoring the entire process. And on the other side, the union is demanding no tax and no this and no that, and no mandatory vaccine, but they are not providing any clear indication as to how they intend or how the government should manage people who would definitely be at risk. So what was it? 2,500 people dead for you, 15,000 people infected. And the statistics show that the majority of people who died are the unvaccinated. So the science, you can't ignore the science. But at the same time, giving respect to people's rights to choose how they treat with themselves, how they protect themselves, well, there are other alternatives. Mandate.
I hear you on that. As someone who would have been on both sides of the fence, and I'll make the joke that like you're going over to the dark side now in that regard. But I understand your perspective and your experience of both categories. Is it possible? Is it reasonable to think that both sides, whatever happens this afternoon, could actually recognize that the brinkmanship helps nobody, that the strong language helps no one, that the confrontation only makes things worse, and that it's better to pull back and come up with some sort of compromise position for the sake of the country?
Zero. You know, if you follow the pattern of all parties who are involved, we might be inclined to say that nothing might come out of this meeting this afternoon. But we are in, as they say, unprecedented times. We're in a time where, as a matter of fact, one of my friends recently said to me, we are not in a recession, we're in a depression. And people are just ignoring the signs around us. But if these people who are holding these powers and have the ability to make decisions that will impact on the country going forward in the next year for sure, they don't see the importance at this juncture of setting aside their differences, then we are really, really in trouble.
But how is it possible? How is it possible that they can't see that? I mean, we're going to stop. We're going to pause in a short while.
Exactly.
And, I mean, how? I mean,
exactly.
I know it might sound like too much of a philosophical discussion, but we just have a few minutes. How is it possible that you can't see this, whether you're on the union side or on the government side? We see the widening disparity between the haves and the have-nots. There's a lot of money in this country in very few hands in Trinidad and Tobago, as with many other countries. And so therefore that widening disparity that we have, how is it that these two sides can't see that, and that going in this kind of butting heads direction is taking us nowhere? How they can't see that?
You know what might be the problem, Fazir? The people, and this is a lesson I learned from ArcelorMittal, the people who sitting in that conversation, none of them struggling to make grocery. None of them worrying about what I'm going to eat tomorrow, or whether or not I have money in the bank. That's the unfortunate thing. The people who this is affecting are the people on the ground, and who will be supporting either side, one way or the other. And these are the people of this country really need to, at this juncture, give their leaders instructions and stop just taking personal comments and personal feelings from these people as the guide for going forward. That is where we are at this juncture. I've looked at some of the commentaries coming out in the newspapers, and some of the people are calling a spade, but you can't just sit behind a desk and say that. People really have to give instructions to their leaders.
And because we're talking about something that is unprecedented, like a pandemic, not just hours of work or minimum wage and other things which are important, we're talking about something that is completely out of our control in many respects. Do you actually believe this could be a game changer as far as the imperatives that we now face, or is that actually trying to be too optimistic?
Well, I want to be pragmatic. I want to be pragmatic, and in that context, normal conditions or average conditions, not even normal, average, even in contention, I would be inclined to say that nothing will come out. But given the circumstances, the dire circumstances, and the potential for unrest, and that is the scary thing. That's one of the biggest concerns that businessmen have. If you have 20% of your police service unvaccinated and you're going to tell the 80% that you're going to vaccinate or else I won't pay you, what's your situation? If you have your nurses like that and you have your public servants like that, what's going to happen? Now, somebody mentioned to me there's an alternative perspective as well.
Very quickly, because we just have a few seconds. Very quickly, go ahead.
Okay. The government does have a serious financial problem in its hand, and we definitely can't have another lockdown. That is something people need to be aware of. That's obvious. They can't continue to pay grants. We have no money.
That's an important point.
So that's something people need to think about.
Ram Kumar Narayan Singh, we want to thank you very much indeed for taking the time to offer these different perspectives on what is clearly another dilemma that we face here in Trinidad and Tobago that we really haven't attempted to even deal with, even though we've been experiencing the pandemic since March of 2020. Yeah. Ram Kumar Narayan Singh, thank you very much once again for taking the time. Coming up towards 7:50 in Trinidad and Tobago. Let's take a break, and then when we come back, we'll have our news packages for you. But as we take that break, let's look at some flowers here. It's a version of the hibiscus, not exactly the hibiscus itself, but it's a variation of it, I believe, as we go to the break.